Okay, so let's scroll down here. We got through boha last week, right? Chinese mint, yobangzi, arcti fructus. Easy way to remember that this herb is cold instead of cool is the fact that it has arcti, thank you, autocorrect, in its name. There may be some spelling errors in what I've written out for this class. You're responsible to know exactly what's in Bensky, so I'd recommend spell checking me. If you find errors in anything I've written, please let me know. I copied this and reviewed it, but we're now at like a 112-page document, so there are going to be errors. Just let me know as you find them, and I'll let you know as I do. Okay. So we did Chuntui, right? The cicada casings. I think it was posted a picture of that in the Slack, a little bit of chat about it. And then we had a lovely comment about it that mildly disgusted me for a minute. That was good. So right, part of what you're remembering here, cicadas, very loud insect. The main thing we're using these for is aiding the voice as a part of this dispersing wind and clearing heat. So a person who gets a wind heat gets a dry throat and also begins losing their voice. We think of the cicada casings. Jonathan had asked me about kosher herbs last week, and I sent him some information about that. Anyone here who's interested in that, let me know, email me, and I'll forward the information along to you as well. Jonathan, I hope that was helpful.
Very much. Very much.
Good.
Thank you.
Yeah, you're very welcome. Okay. We went through Songye. So even though this is cool acrid herbs that release the exterior, we're seeing multiple cold herbs in this chapter, whereas in the warm acrid release exterior, we didn't see a lot of hot herbs. Here we're seeing more cold herbs. We discussed some of the functions here as the super common herb for wind heat, Tsungju yin. Songye gets used with juhua, the next herb, the chrysanthemum flower. We mentioned the fact that there's multiple types of chrysanthemum, but in general, you just give this one. If you feel like making something special for yourself or for a friend, using some of the more specific ones can be nice, but in general, people just use juhua. And if you write juhua on a prescription, they'll assume you mean the standard variety. These two work nicely together. Juhua focusing on lung and liver, Songye focusing on lung and liver, paired together. Both of them have an effect on the eyes and moistening dryness. This one less on the moistening dryness and more on the getting rid of the heat that's causing the dryness. So the two have a nice pairing. Juhua gets used, it has the nickname of the poet's herb and gets used especially in the evenings to help people relax. Not very strong, but it does help. Manjingta, fairly straightforward, but now we're adding a little bit of dampness in. We're seeing a lot of this benefiting the head and eyes. So anytime you're seeing symptoms manifest in the head and eyes, that's something you see with wind heat. Wind heat tends to create nearby issues. Wind cold tends to be more in one place. Wind heat tends to bleed outwards. Keep in mind, your board and comprehensive exams like asking about traditional contraindications. So Manjingsa is not combined with Futsa or Shigao. And we finished on dandochi. This is the prepared soybean. It can be prepared in multiple different ways. And how you prepare it is going to change its temperature between cold and warm. It's always going to be sweet because soybeans have a naturally tonifying function, and slightly bitter. It releases the exterior, but like not very strongly, not very well. And it helps to eliminate irritability. This is kind of the idea that you see in the Japanese soup that you get before eating dinner that my mind's blanking on. Miso soup, thank you. Kind of the idea that you have in miso soup, where you have varieties of different ways to prepare miso, where you get different flavors and temperatures imparted into it. Except here, this gets combined with songbai, the scallions that we asked about on the quiz. Two mixed together provide for a gentle release of the exterior that works well for elderly people and for deficient patients. Of note, there are no cautions or contraindications. So if you're using the cold version, you should probably not use it on people with very weak digestive systems. And now we're getting into some new herbs. So starting off with Phuping. I think what I'd like to do is have you guys keep looking at, is this similar at all to natto? I'm not really sure. I don't have much personal experience with natto. So sometimes it's through the tasting and the, yeah, I mean, so the question is like, what is the fermenting process that they're using? So yeah, you're going to see fermented soybeans all over all different types of Asian cuisine. And some of the things we're going to talk about are going to look like, oh, well, this fermented thing that kind of looks like kimchi, but there's 1,000 ways to ferment within the kimchi tradition. So it's a little hard to say. Soybeans being ubiquitous across Asia, you're going to see a bunch of different ways of preparing it. It's very different from tofu. It's very different from tempeh. Those are both, so tofu is very cold and pretty difficult on the digestion unless combined and prepared properly. Tempeh is a whole other story. So soybeans they're a little too universal to make too many statements about. Just, you know.
Planting soybeans is actually a really long process. You have to, I've watched people do it. You have to like steam it and then let it sit for days. I mean, it's very arduous.
Yeah, it seems rough. They do happen to be like pretty, you can do it in large batches though. So, you know, not really something to do at home that often. Yeah, thanks for adding that in. Okay, so let's take a look at Phuping. So, kind of looks like this. I would say in most of your herbs kits, it should just look like these little leaves, almost like clovers that have been dried and split apart. This is going to be acrid and cold. Go to the bladder and lung. So this is the first time we're seeing urinary bladder in the, I think this is the first time in the cool acrid release exterior category. So that's a change. We're not going to be using it for anyone who's already deficient, and the dosage is standard. Induces sweating and releases the exterior for patterns with heat in the body and body aches and an absence of sweating. So this is the part of it that we care about. This herb releases the exterior much stronger than any of the other ones we've gone over. But that's not something that's as important with a heat pathogen. Cold pathogens enter your system, and it's the nature of cold to lock things down. So you have to forcefully cause sweating to push out the cold pathogen. Heat pathogens, very often the language looks something more like disperses wind heat or vents wind heat. So here, what we're saying is that with Phuping, for the first time in this chapter, okay, that's not helping. For the first time in this chapter, we are inducing sweating. So this is one of our strongest diaphoretic herbs that is also cooling. That's the main thing to know about this. Second to that, not great. It's going to vent rashes and stop itching. Anything that's venting the exterior is going to tend to have some level of function with that. This is generally not our go-to choice for this, but it does get included in these formulas for hastening the expression of rashes. And the last one is that it promotes urination and reduces swelling. For hot superficial edema, primarily when the upper body is affected and there's urinary difficulty. All of this is to say, this herb is basically the cooling version of ma huang. It releases the exterior forcefully and it promotes urination. Just like ma huang does. Just like ma huang, we want to be careful, and we're not going to use this if the patient's already sweating or if they're deficient. So in your head, Phuping, kind of a cool version of ma huang. You would think that because of that, this is going to be used all the time, but the reality is we rarely actually have to induce sweating in patients with external wind heat because they're usually already sweating. And we're not using this in patients who are already sweating. So this is for...
Yeah, what's like the rare case? What would be like a good example?
Honestly, I haven't ended up using this very much. So we're going to use this. The place that this ends up getting used the most is less for this inducing sweating function. So when cold comes in, cold causes the pores to close and prevents sweating. In the case of heat coming in, what we're looking at more is a disruption of the fluid metabolism within the person's system, resulting in edema and an inability to sweat. So really, this reducing swelling should go with this inducing sweating and releasing the exterior function. If you want to do this, but the person's dry, this is probably not your herb. So it's like they're holding all this fluid that they need to get out. They're going to start sweating. They're going to start urinating. And that's the main thing we're going to do.
Oh, Peter, sorry, can you pause for 1 second? Can you go back to make that point one more time about the difference between when the heat enters versus when cold enters?
Sure. So cold, the nature of cold is that it contracts. Whatever cold gets involved with contracts. If you get cold in the sinews in your chest is going to close inward. If you get cold in your ankle, you're going to reduce the mobility of your ankle is going to go down. Heat's the opposite. Heat makes things move too much. When cold enters your body, there's different ways that this can happen, but in general, it locks down the pores and prevents sweating. The kind of received wisdom within culture of like, oh, a fever is going to break when the person starts sweating, they're talking about a wind cold leaving the person's body. So ma huang is used to push out that cold and start sweating. When heat comes in, you're generally immediately sweating because the heat itself is not interested. The nature of the heat does not close down the pores. Enters through the mouth, the heat affects the lungs, the skin starts to sweat. It's a fluid issue as much as it is anything else. The fluids are being heated up and they're leaking out of the body and the lungs can't hold them. This is for when the opposite happens. When the heat comes in, the person kind of swells up a little bit, gets a little bit of edema and doesn't sweat, but they have a rapid floating pulse indicating a wind heat. I've highlighted this here. Bensky says what I'm saying. The ability of this herb to spread and disseminate lung qi is primarily confined to assisting the lung's fluid metabolism functions. So the lung's job is to down bear fluids. Person gets a little bit of, so you might see someone who gets like swollen around the eyes when they get a wind heat. Like it just gets puffy in the face, maybe a little swollen here, but they're also red. And maybe there's like a sheen of oily sweat, but they're not sweating. In that case, we'd consider this.
Thank you for that clarification.
Yeah, so you're very welcome. Ability to drain water downwards is what we're looking for more than anything else. I would recommend, so in general, I think you should all read all of every one of these herbs as we're going through this. Some of them, they have a lot of important information. All I want you to remember though, is each of these pieces, right? What I've given you in that document is all I'm really going to test you on. And all you're really going to get tested on in future exams. Okay, that's Phuping. Make sense? Okay. So, and I'm just going to reiterate this. This is what it's doing because it goes to the bladder and lung. Almost the same functions as ma huang, but due to its cold nature, it's not going to be working with wind cold. If this herb was hot, it would be working with wind cold in this situation. You should be able to look at the functions and basically figure out what this herb is doing. It's interesting to me that it's not bitter due to how much it descends and moves downwards. It feels like it should be listed as bitter, but it isn't. There's probably been argument about that historically. Okay. Mudze, Equisetti hiemalis herba. So sweet, bitter, and neutral. We're in the cool acrid release exterior category. This herb's neutral. Sounds like the sort of thing that might be fun to test. Goes into the liver, the lung, and the gallbladder. So we're seeing lung, which we should expect. Almost everything in this herb enters, almost everything in this category enters the lungs. And then it's going to wood. Excuse me. So what we're being told is this is a wood herb that also works on the exterior. Disperses wind heat in the exterior, specific for superficial visual obstruction. Standard dosage, be careful if the person's already deficient. especially deficient of fluids. We're going to see that a bunch here. So first function, disperses wind heat, clears the eyes, and reduces superficial visual obstruction. So similar to some of the other ones we've talked about, like Juhua, it's going to help with heat that affects the vision, that affects the eyes, redness in the eyes. A person who comes in with bloodshot eyes and has a rapid floating pulse, this might be an herb we're going to think of, especially if it's coming with a headache right around the eyes, a temporal headache or a orbital headache. And it's also and that's actually one of the, you see it right here, used with Juhua for swelling, pain, and redness of the eyes. It also clears heat and stops bleeding. We kind of use it for this. Not a ton, but we do. This herb is used for treating red eyes. Very similar in function to Juhua, except that here we're also going to use this when a person just has heat in the liver and the gallbladder. So while this is an exterior herb, we do use it for some interior conditions. Yeah, that's often where we see it the most. So that's all highlighted in here. This herb treats all diseases of the liver and gallbladder from turbulently rebellious pathogens. Just translate that as heat for now in your head. It can, this is the main thing we're going to use it for, and we can also use it for wind heat. This is one of those herbs where it needed to go in a category. It fits here decently well. How are we getting heat out of the person's body if it's neutral? Anyone want to take a guess? There's multiple answers.
I mean, contraindication is frequent urination, so I'm guessing there's like some exit of urine happening.
Yeah. So, well, even before that, we know that bitter is going to drain downwards. That's one of the functions of bitter. So this is going to help to descend that heat out of the head and the eyes. It's going to do some dispersing, but this isn't particularly accurate. I mean, it's not accurate. It's sweet, bitter, and neutral. So it's going to be descending. The second piece is neutral as a temperature is kind of interesting. Neutral is not interesting. I'll get to the chat in just one second. Neutral is kind of interesting. Neutral doesn't mean this herb doesn't have an effect on temperature. It means if the patient's hot, this herb is cooling, and if the patient's cold, this herb is warming. This herb will bring people towards a neutral temperature. It doesn't lack temperature, it has a neutral temperature. So when you're using this with patients, you want to keep, when you're using any herb with a patient, you want to keep this in mind. An extremely hot patient being given mildly warming herbs can be cooled by them because relative to their heat, the herbs are quite cold. So sometimes with very hot patients, some of the herbs that will be used to open up passageways to get the heat out will be mildly warming, and we're not really concerned about that because that's not going to add to their heat in a way that really matters. Someone here in the chat privately said maybe it pairs with an envoy that aids in eliminating things. That's actually pretty close to accurate. We pair this herb with herbs that promote urination. That's one of the things that happens quite a bit. So let's see here. Are they, well, we haven't covered these herbs, so that's not very helpful, is it? It gets used with chrysanthemum a lot. And then Tsungju would be an example of a good, well, that's a damp herb more than anything else.
Is it related?
Go ahead.
Is it related to bamboo? I'm just looking at the pictures online.
It's what is it, horsehair, horse something. It's not. I don't think it's related to the bamboo. It has a similar sectional nature to bamboo, but it's squishy. It lacks that hard outer shell that bamboo has. That's so distinctive.
Okay.
You see this. You see at least relatives of this walking around lakes and swampy areas on the West Coast. I haven't done enough hiking locally to have noticed much of it, but yeah, it doesn't have a whole lot of, it kind of just smells planty, like a little bit green, little petting zoo-like. It's very light. So 9 grams of this herb is quite a lot in terms of the apparent volume as well.
Right.
Jonathan, you have a question?
Yes. So I'm trying to figure out, to make sense, how the flavors like working with the channels. So for example, bitter, I can understand it goes with the liver and the gallbladder, but I don't see here acrid for the lungs. And I also don't see something like, yeah, so this more treat the liver and the gallbladder than the lungs.
Yeah, there's more treats to the liver and the gallbladder than the lungs.
But still, it's have effect on the lung, even if it's,
Yeah.
if it's not acrid.
So the effect on the lungs is basically just going to be this dispersing wind heat function. All it's doing is helping release the heat from the exterior. If your patient comes in with heat in the lungs, this is not the right herb. If you're part of what they're saying with lungs is this is it for external conditions. We're not using this for liver fire, internally generated. We're using this mostly for externally contracted wind heat that's resulting in the sensory organs related to the liver and gallbladder being affected. And while it might seem like, why do we care so much about redness in the eyes? We don't care about redness in the eyes. We care about the fact that the redness in the eyes is telling us that the heat's affecting their liver and gallbladder. And if we don't get that out, along with whatever else we're trying to get out, then that might linger and create problems in the future. Okay. Kyria, you got a question?
Yeah, I just wanted to back up a little bit. You mentioned like if a patient is warm, you might give them something that's warming, but it's not a big deal because it'll kind of bring them, it'll kind of cool them in a way.
If a patient's very hot,
I'm sorry, yeah, they're very hot.
Something mildly warming, yeah.
Right, I guess that's kind of interesting for me because I always thought that like if someone's very hot, to give them warming would be like a contraindication. So.
Right. Well, in general, the formula is going to be cold on balance, but in the same way that like, if I put room temperature, if I put a bunch of room temperature things into my freezer, the temperature of my freezer is going to get warmer. And if I put a room temperature turkey into my oven, it's going to cool down my oven. That's the basic idea here, that these things are not without temperature, that they have their own weight of temperature and it's neutral. Too much neutral temperature can be bad for the stomach because the stomach likes to be hot.
Right.
For example. So even though you're like, oh, it's neutral, that doesn't mean you don't have to think about the temperature. Lots of neutral stuff in the stomach will be too cold.
Okay, thank you.
Yep. Good questions, guys. This is the sort of question I want where you're showing that you're trying to think about these things as opposed to just memorizing them. That's great. Okay, Gun is a great herb. If this would scroll forward. Just once though, please. Okay, here we go. Where's the herb? Oh, I see what the problem was. Okay. Oh. Sorry, I'm trying to do this with like a chat screen open on my computer and pictures of you guys, so I'm having a little bit of trouble seeing the actual book. 1 second. Here we go. Okay, Gun. Ferrariae radix. People are going to pronounce these things differently, by the way. Like even East and West Coast, there's just some phrase, like different pronunciation of the Latin. No one really knows. We all make it up, but they're pretty consistent regionally. So Ferrariae radix. This one's sweet, acrid, and cool. And as opposed to Mutze, which is sweet, this one makes more sense as a sweet herb. First thing to note, so couple things to note. Acrid and cool makes sense for the category. Sweet, not very common for the category, but there's a bit of it. Spleen and stomach's real weird for this category. That doesn't make a whole lot of sense at all. We're definitely talking about the interior if we're talking about spleen and stomach. There's no, if it's spleen, stomach, lung, spleen, stomach, UB, we could talk differently, but this is an odd thing for exterior conditions. So we know that this is going to be doing something somewhat strange given that it's in this category. And it does. This herb has a tropism, a directionality. This herb moves upward, raises the clear yang qi, and releases the muscle layer. So this is for, we'll come down here into, and the dosage, high. We dose this high. This herb kind of looks like, I'm thinking of Lugun for that. well, this herb looks like chopped up bits of twig. Less interesting. Of root. So discharges exterior conditions and releases the muscles. So person gets a wind heat. How are we doing the time? Person gets a wind heat. The wind heat penetrates into the lungs and it's in the skin. If that descends a little bit further, the person gets body aches as the heat penetrates into the muscle layer. Heat in the exterior, the person just feels hot and they're sweating and maybe like a little bit of dizziness, red eyes. As the heat penetrates further, it starts to look more like a real flu. The person starts getting body aches, starts getting muscle pain, might even start getting cramping. That's where we start using Gogun. For the people who are from the South, you might know kudzu root quite well. It's growing like crazy down there. Gogun discharges exterior conditions, releases the muscle, so that's for the heat that's penetrated a little further. And it also generates fluids. This is what the sweetness is. So this herb has a tonifying function. We can build up fluids with this herb. There's not that long a list of herbs that build up fluids, and they're good to know. I mean, there's a pretty good number, but so far we haven't really seen many. And this is a great function. When a person has a wind heat and they lose fluids and they get thirsty, we often end up giving them, chicken broth, or I'm just talking generally culturally, give them Gatorade, give them water. Those things may or may not actually generate fluids. I'm sure you've had the experience of getting sick and drinking tons of water and you pee it out, but you don't actually get hydrated. Excuse me. This herb generates fluids. So for a patient that gets sick with body aches, with dryness, this is what we want. This is also where the cramping comes in. If the heat is in the muscle layer and it's cooking off the fluids and the patient starts getting muscle pains and these like transient cramps that come and go in the muscles, you can sometimes get rid of the majority of the disease, but the fluids in the muscles have been damaged by the disease that has come through, and those cramps may persist for a week, for 2 weeks, until those fluids get regenerated. If you add Gogun into the formula you give them, those cramps are likely to go away within hours. And the last one is this venting and discharging measles, which really is just telling you it pushes outwards at the skin, which doesn't make as much sense here because we're not going to the lungs. So they're also saying here, this is for somewhat deeper levels of these rashes coming up. If they're in the muscle layer, you're going to want to add this to push. Kyrie, I'm going to take your question. I'm also going to move this to the other room because I want to use the whiteboard to show you a little bit of stuff about the muscle layer. So Kyrie, go ahead.
I have a question about this herb. Like you say, it generates fluids. I guess or it helps you, generate fluids. I understand how, like, if you needed to build blood, how your spleen would be able to create more blood, and that's what the body does anyway. But I don't understand how, if you don't have fluids, how is an herb going to help you create more fluids, or where is it being created from? It's more maybe more of like a anatomy question, a physiology question, but I'm just curious.
Sure. So from FCM2, for the people who took FCM2 with me, you'll remember that when we talked about the spleen and about the stomach, we referred to them as the source of fluids in the body. You get fluids through the liquids that you eat and drink. You also get them from the food you eat. And in this case, if we were taking Gogun, like, I don't know, if you were dry swallowing capsules of Gogun, it would probably not produce fluids. This is something that you have to take with liquid. I would actually guess that if you were taking tea pills of Gogun with cold water, this would probably not generate fluids. If you cook this in water as a tong, as in the standard way of preparing herbs, then this will generate fluids, and the tea that you make with it is going to have a little bit of a viscous texture to it, just a little bit. So this generating fluids is almost more of like a characteristic it imparts into the liquid you drink, that the liquid becomes more hydrating. But then again, that's the function of every herb, that it imparts its function into the water. So you guys can see, okay. So we got the skin at the outside, got the tsoli, and then we've got the muscle layer. different herbs release different aspects. Can you guys see this? Get this a little closer.
Yeah, if you
Different herbs.
if you pin your video, it's perfect. Like it's how you were is fine. I mean, not you, but if we were to pin your video,
Oh, yeah.
pin your page, it's good.
Yeah, this should help.
You can
Okay.
spotlight your video though. That's like the same as pinning, except you do it for everyone.
Okay, that's good to know.
It also means that only what you spotlight gets recorded on the recording also.
Oh, that's also good to know. I have no idea how to spotlight, but maybe you can tell me during the first break.
Yeah, if you're the host and you click on your, like, in your participant list, you hit more.
Hey,
you should be able to spotlight yourself.
Thank you.
A tech specialist.
Appreciate that. Still learning these things. Yeah, Jarrett, good IT work. Thank you. All right, so wind heat can penetrate to different levels. And depending on how far it penetrates, we're going to use different combinations of herbs, because different herbs are going to release at different levels. If your wind heat is very much on the exterior, this is when we'd be talking about something like dandocher, which we just covered in the warm acrid release exterior category, just prepared coolly. We'll kind of push like that. When we're talking about like bohe, we're kind of in here, maybe in here. When we're getting down to the soli, we're going to want to add in a couple more things. We might be talking about, if the person's not sweating, this is definitely when we'd have Phuping in the mix. Sorry, Phuping, am I saying the wrong herb? Yeah, Phuping. But once you're getting down to the muscle layer, one, if you're in the muscle layer, you're almost certainly affecting the spleen, stomach, and the liver with their association with the muscle. But if you take an herb like bohe, you still see this? Yeah. Bohe, and you apply it to this case here. Let's forget this last case for now. And you use bohe to release this, you're going to come down here and you're going to push the heat out, and that will work, except that the patient will retain some heat in the muscle layer. And this retained heat can be the beginning of other problems arising, be that long-term local issues in the muscle layer, be that heat in the liver that begins to sit there that could turn into something over time. Lots of different ways this can be an issue. So depending on how deep the pathogen has entered, you want to use an herb that will push out from there. And very often, Gugun is going to push nicely out of the muscle layer. Then you bring in something like bohe to support it, and something even like Tsungju to aid as well. And so you're pushing from the depth of where the heat is penetrated all the way up to the surface. If you don't do that, you can leave some aspects of the pathogen inside the person's system. If you leave pathogens in the person's system, most of the time they'll just spontaneously recover, just like they would from a cold or a flu anyways, just might take longer. But sometimes you might be setting them up to have a longer term issue.
So in this case, like Goga is almost like it's like, it can be corrective kind of? Is that what you're kind of showing with that?
Yeah, so when you're diagnosing your patient, and they come in and you go, okay, I know they have a wind heat because they've got a rapid floating pulse and they're sweating and their eyes are a little bit red and their skin's hot to the touch, and they're saying it started with a scratchy throat. They say all of that, you go, that's a wind heat. And then they say, I'm also getting muscle pains. You know the heat has to have gone to the muscles. And so as soon as you know that, you know how you're either choosing a formula that goes to the muscles, or you're adding in herbs that go to the muscle layer for into whatever formula you're picking. We also use Gugun as an assistant just to generate fluids. So sometimes we use it when there is no exterior condition, just because we want to add fluids to the muscles, but that's usually a smaller dose.
And if you did the opposite and used Gugun on something that's more exterior, would that just be super draining and like too forceful of an herb?
That's, I mean, that's less of an error than not using it when you need to. It's not necessarily that big of a deal, except that, yes, you'll just be pushing out a little bit extra. And there's also, you don't want to, there's a number of herbs where it's like, there's no contraindications for this. They're basically safe for everybody. So why don't we put them in every formula? You don't really want to dilute the formula with things that aren't doing what you want. There's really only so much force of a single formula can exert on somebody before it becomes too much. I'm just trying to stay vague because I don't think you guys have the terminology for this yet. There's only so much you can put into a formula before it's going to overwhelm the person. So you want to be specific in what you're doing. And that means you don't want any herbs that you don't need, even if they're safe, even if they're not going to hurt the person. Like, I guess it's fine to have them in, but the function of the formula will be diluted. This is true of acupuncture points as well. If you're treating a wind cold with acupuncture points, and then you decide to add in a bunch of other points because you like them and you think they might make the patient feel good, you're going to be less likely to succeed with the actual thing you're trying to treat. So adding Gogum when you don't need it isn't necessarily the biggest problem because it's not that draining, but you don't use herbs you don't need. There are no cautions or contraindications for the herb. One second, let me figure out how to unpin myself. Can you see me or do you see Bensky now? There we go, got it. There's no cautions and contraindications for Gogun. It's a safe herb, but yeah, that doesn't mean you use it all the time. Next function for it, the rest of the functions are kind of along the same thought process. Relieves heat, generates fluids. This is the thing that we use it for in relatively small doses with other formulas. Important point here, and I want you to make a note of this. We use this to help treat diabetes. Diabetes in Chinese medicine is called xiaoke, wasting and thirsting disorder, and it primarily affects the lung, stomach, and or kidneys. And if it affects it primarily affects the lung, stomach, or kidney and or kidney yin, which means it's damaging the fluids or is caused by damage to fluids. So often when we're treating diabetes, we look for herbs that generate fluids. This is one of them. So if you have a patient who comes in who's diabetic and is also flushed and also tends to be hot quite a bit, especially if that heat is at night, especially if their blood sugar levels are not well maintained and they're always thirsty, we're probably thinking about putting Gogun into their formula. Raises the yang and stops diarrhea. We mentioned it moves upwards. The tropism of this, the directionality of this herb is up. And so it helps to prevent diarrhea or dysentery due to deficiency or heat. Sometimes you get hot and that heat pours down into the heat in the lungs. Heat in lungs goes down to the large intestine. And you kind of just start dumping that heat out that way. In this case, this is just going to help to lift and support that and also undo some of the fluid damage that you're going to get from the diarrhea. And the last one is that treat symptoms of hypertension. I don't care about that. That's there, but that it's atheoretical. It's worth noting, but we're not going to do much with that information. So really cool herb, really useful herb. Sometimes you'll see this in just a couple grams in a formula because you're trying to use it as an envoy to raise the yang. Sometimes you're going to see it in a moderate dosage because you want to generate fluids and cool the patient. And sometimes you'll see it in a high dosage because you want to discharge exterior conditions and release the muscle layer. So it's kind of different functions depending on the dosage. That makes sense? Do you guys understand the thinking there? That you with me on this? Seeing some thumbs up, and some nodding. If the answer is no.
Can you say the dosages again?
Sure. So 9 to 21 grams. I don't want to. We're not talking about individual gram dosages here in this class. I don't really want you to learn them now. You're going to do that much later on, and if you're adding in a bunch of thinking about dosages right now, it'll get confusing. What I do want to say is this herb is dosed higher than most herbs. 9 to 21 grams. Don't have to remember the number, just think like 3 to 9, 3 to 12 is pretty standard. So this is higher than normal. And if you dose this low in its dosage range, maybe like 9 grams or lower actually, this is an envoy, which means it'll just help raise things upwards. If you're dosing in like the 9 to 12 range, you're probably trying to generate fluids, though sometimes that gets dosed very high to generate fluids in some cases. If you're more at like the 15 to 21 range, you're probably trying to release the muscle layer and the person probably has an exterior condition. So for diabetes, we're more in like the 12 to 15 range. But sometimes that's different. It's just a starting way to think about it. Again, don't start giving your friends who are diabetic this herb, right? This is wait until formulas. It's hard to resist, I know. I say having poisoned myself multiple times as a herb student. Okay, sorry, got a couple things here in chat. Let me see what's going on here. Yeah, anytime I'm talking about gugun, I'm talking about type 2 diabetes. Type 1's a whole different story. You might be able to support them a little bit, but they don't necessarily have the same damage to the same systems because we're talking about an issue with their Jing. If we're talking about type 1 diabetes, right? Anything people are born with, the whole etiology is different, and therefore the way you resolve it is different. Shini, yeah. So that cooking it, turning into a paste thing, that's the kind of slipperiness that it adds to the liquid that I was talking about that helps it in its hydrating quality. And yeah, you can find like jello things, gelatin things made from gugun. It doesn't have a whole lot of flavor, so it's a nice carrier in that sort of way. How do you cook this herb? Well, like most herbs, actually, I have an herbal formula I just picked up for a friend here. I mean, I don't know how many of you have dealt with raw herbs before, but I'm gonna start taking herbs at some point just to get the experience if you haven't historically. So this herb would be given, gugun is not in this formula. This is a formula for low back pain. But normally what you're getting is a bunch of herbs in a bag like this. There's a variety of different ways to prepare them, but the most common thing to be done is you put it in a pot of water with 8 cups of water in it, and you cook that down to 2, and you drink 1 on the first day and 1 on the second day. That's the simplest and easiest way, and it gets more complicated from there. There's a new method that's becoming popular. I need to give you guys a break. I'm sorry. If I just start forgetting breaks, just say something. In fact, let's take a break and I'll talk about some preparation methods for when we come back. Let's the people who are having quiz-related difficulties, please stay on for a minute. And yeah, there's some other preparation stuff. We'll talk about all that. Okay, quiz folks, what's the problem?
When should we come back, out of curiosity?
10 minutes. So it's 7:29. So 7:39, please.
Thank you.
Who has problems with the quiz? Who's still here?
I had a problem with the quiz. I wasn't able to submit, but eventually I did submit it. It wasn't. I was just putting in the Latin name, but then I had to put the opinion first, which I didn't know that. I was just writing down the Latin name because I already wrote down the opinion at first.
Yeah, I was trying to set this quiz up so it would do some auto grading, and it just broke that question. I thought I'd already deleted and fixed that, but sorry. I'm glad you got it in.
Yeah. I figured it out. Let me just try writing out the whole thing again, and it went through then.
Great.
Right. Thank you.
Sorry for the inconvenience.
Yeah, thank you.
Okay.
I'm sorry. With the Latin part, sometimes I may be off by a letter. I'm still trying to get it all. Any suggestions about that? How to memorize Latin?
I would recommend saying it out loud and pronouncing every letter.
Okay.
So that you have in your head. So it's not a Fedra herba, it's a Fedre herba.
Yes.
So you know it's AE, for example.
Okay.
So however, like again, you're very rarely going to pronounce any of these things out loud.
Yes.
So I'm going to try to repeat them as we go through them. So it's Poirarie radix. So I'm trying to put every letter into that. And for me, that's how I remember it. I check like the Fedre herb. Okay, yeah, it is a. That's my recommendation.
Thank you.
Yep. Thanks, Edwin. Jamila.
Yeah. Yeah, when I was like out almost finished, I only had like 2 questions left, and it was like Microsoft was not responding, and they keep on giving like the circle like it was loading. And then it just stopped loading, and then it says I gotta open it in my browser again, and then it just went back to the whole new quiz.
Were you able to submit it at the end?
Yeah, I submitted, but I didn't finish. When you said please submit it, I just submit what I had done, which was like I did like probably like 5 or 6 questions in like a minute, and then I submitted it. So I didn't even get a chance to finish it. I don't know what happened. I don't know what happened. It just said Microsoft is not responding.
Yeah, I mean, this sounds like a problem on your computer side, not one in the design of this.
Yeah.
That doesn't mean you're on the hook for it, because it's not a requirement to do this program to have your computer work properly all the time. So what I'm going to do is I'm just going to leave this open. And if you want to go in and do it right now, you go for it. And I can grade that. I'm not quite sure what else to offer. If you have any other ideas, I'm open to them.
I don't have any ideas right now.
Okay. Well, so I'm just going to send this to you. I'm just going to put this in a private message to you with another link to it. And why can't I find your name? There we go. And just go ahead and do what you can on it for now. We'll be kind on the grading on this one, and then next week people will know what to expect with this.
Okay.
Peter?
Right. Thanks, Jamila.
Thank you.
Anyone else?
Peter, it's Marianne again.
Hey, Marianne.
Hi. So yeah, the Mawang, I was trying to put the ephedra in there, and I didn't see, I was trying to toggle back and forth between Zoom. So what I wound up doing to submit it was I just left it blank. And it was actually we learned this in intro, so it was like the easiest answer to provide on the test today. So I was like, I can't answer, but I'm not worried about that. My question is around, since I don't know how intuitive the system is to do like this auto grading, if you will, like some of my answers, like I might have a comma or I might have a couple.
Yeah, I realized actually I can't do auto grading for this, just because if it's fill in the blank, it doesn't work. This is still 3 times faster than Moodle, even without the auto grading. So I'm hoping to give you guys long, detailed quizzes focused in on what we've talked about, which means I'm going to generate them every week, and that can't happen on Moodle. Moodle won't. That'd be a train wreck. So.
I didn't want to ask during, and I said, well, I'll do a comma here, I'll do a slash there, or but I didn't know what kind of intuition was built into the system you're using.
Sure. The intuition is I'm going to read them all.
Okay.
Yeah.
All right.
But good thinking. I appreciate that.
Okay. Thank you. When do we come back?
5 minutes.
Okay.
7:39. Any other quiz-related questions? If it's not a quiz question, I would appreciate it if you wait a minute. Everyone's good on the quiz. Okay, great. I will be back in just a minute. If anyone has other questions, I am available. Okay. Welcome back. Let's wrap up this cool, accurate release exterior chapter and go a little bit further and then call it a night. Okay, so that's it for Gagun. If I remember correctly, it's been a little while since I've read it. There's quite a bit of interesting stuff in the Gagun expanded commentary section. Yeah, so here's some information on the Gagun as a starch. Unprocessed root is ground with water and then allowed to settle in order to extract the starch. Nature of the starch is somewhat different. Very cold, generates fluid, alleviates thirst. So yeah, you can look through this stuff. I find it's sometimes hard to get the various different parts of the plants since people tend not to get this specific, but it's interesting to read about them because often what they're doing is highlighting and going a little bit deeper into the functions of the whole plant as well. Yeah, so worth reading, I would say. All right, Chai Hu, you all learned Chai Hu last semester, right? No, Chai Hu is not an intro to herbs herb.
I want to say Gesundheit.
Someone sneeze on the chat there.
Chai Hu.
Oh, that's good. That's good. Okay, Chai Hu is, when I was in school, this was taught in Intro to Herbs. This is an important herb. This is probably the most important herb from this section, from this category. It's buried this deep because it's not really a cool acrid release exterior herb. It's a Shaoyang herb, but that's not a category in Bensky, so it's not there. Chai Hu is the main component in the most frequently consumed herbal formula in Japan. So this is a big deal, and we'll get into why. So Bupleury radix, it's from the Bupleurum plant. Bupleury, like plural, might help. Bitter, acrid, and cool, totally fits the category. And let's look at these gorgeous channels that it enters. Oh man, nothing enters the pericardium or the triple burner. Almost no herbs enter either of those channels. So right now, if you see, I mean, frankly, gallbladder is rare, liver is super common, pericardium and sanjiao are rare. If you see all three of these in an herb, it's time to sit up and pay attention to it because this is going to do something special. So on first pass, this is going to seem unimportant, and then on second pass, it's going to get more interesting. Treats alternating fevers and well, let's just go right into this. Standard dosage range. Don't use it with yin deficiency or excess liver yang. That's it. Chai Hu has an upward directionality. We use this to lift things similar to Gagun. Low dose, this is often used as an envoy for lifting. So the herbal formula that we use for people who have like chronic hemorrhoids is going to have a small amount of gegun and of chai hu in it, for example. Main function of this herb, main action, main indication, resolves Shaoyang disorders and reduces fevers. Resolves Shaoyang disorders. So even though we're in the cool acrid release exterior category, so you think cool acrid release exterior, you're generally thinking Wenbing. Cool acrid release exterior, we're often going to be working with the Wei Qi Ying Shui model, but focused really like up here for exterior disorders. And for the warm acrid release exterior, we're generally working with the Taiyang Shao. I'm getting ahead of myself because I'm excited about this. Taiyang, Yangming, Shaoyang, Taiyin, Shaoyin, Shuiyin model, right? Shanghanmun, Wenbing. And this herb, which is in this category, so we should be thinking it's doing something like this, instead treats the Shaoyang stage. It's the main herb that treats the Shaoyang stage. This is our most important herb for treating this. So this is our standard like Ma Huang, wind cold invasion. We'll skip Yangming for now. We'll talk about that in another week or two. We want to keep the disease out of here. This is the bad zone. We don't want to let it touch the yin. Once it gets into the yin, we have real problems. Shaoyang is our last defense before we start getting really damaged by an illness. And this is where chai hu shines. So chai hu resolves Shaoyang disorders, just resolves them. For alternating fevers and chills accompanied by a bitter taste. Pain at the sides, irritability, vomiting, stifling sensation in the chest associated with Shaoyang stage. This herb unblocks this problem. It also spreads liver qi and relieves constraint. Pretty much every formula that will be used for liver qi stagnation will have a little bit of chai hu in it, at least. Very common herb for treating liver qi stagnation. Dizziness, vertigo, long list of stuff. Right here, used for wood overacting on earth. If the liver and the spleen, if the liver's overacting on the spleen, chai hu is one of the first herbs we pull out. The formula Shaoyasan, used free and easy wanderer, used for treating liver overacting on spleen. This is the chief. This is the main herb. I would also like to point out that these actions and indications have many more herbal combinations than normal. When one of these, so if you see a bullet point and then there's a whole bunch of things after it, it means this herb gets used a lot for this function. This herb gets used a lot for this function. Oops, not too many.
You feel like we had my last clinic, we had like a lot of chai hu formulas get prescribed because of it's just like a common, seems like a very common like place where things get stuck for people.
Yeah, chai hu is one of our like great unlocking herbs. And this is one that, so it gets used all the time. I think it might be overused, which is to say, I think it should be given 10% of the time as opposed to 15% of the time. I still think it's wonderful. I'm not diminishing its ability. I just think it's a little bit overused. Herbs that regulate qi can be used in a lazy manner to get short-term results that don't last. We'll talk about that. Well, really, you're going to talk about that next semester, but we might come back to it at some point. And then the last one is that it raises and lifts the yang qi, especially for the clear qi of the stomach and gallbladder. So this is helpful for raising clear qi up to the head And it's also helpful on a mental and emotional level to aid the gallbladder in its function as the spy of the heart. So it can be used to help clarify people's minds and aid them in making decisions by raising up the clear chi of the gallbladder. I strongly recommend that you read everything written in here about this herb, heat from deficiency and gynecological disorders. If you want to treat women's health, you need to be comfortable with chai hu. It's a great herb. Yeah, I think that's about all I really have to say about it here. You guys learned the 3 yellows in Intro to Herbs, right? Huang Qin, Huang Lian, Huang Bai. Yeah, no, maybe not. Okay, well, then we'll talk about this when we get to that herb. So great herb, used for a ton of stuff, used all the time. One thing that I want you to know about it is that it damages the yin. So it doesn't get to do all of these things without a cost to the patient. This is part of the reason I think it's a little bit overused. We don't have any herbs that are consequence-free. And this herb, it submits its bills to the liver yin. So you use this herb to fix a bunch of problems, but over time you can damage the patient's yin. It's traditionally said to plunder the yin, so it's pretty yin damaging. And so you just want to keep an eye on that. That's it. Otherwise, wonderful herb. We've got a couple questions in the chat. Can you please give the Reader's Digest version of granular versus crushed? Maybe beginning of next week, I'll prep a half-an-hour lecture on herbal preparation techniques. It sounds like that wasn't a thing that was covered very much. Yeah, it sounds like that's something we have to talk about. There's a new technique involving thermoses for cooking herbs for people who live with roommates and don't want to stink up their entire apartment. I mean, I like the smell, but roommates tend not to. Let me make a note of that myself. We can do that next week. That's important. So, yeah, I was talking to the school about setting up a little bit of an herbal lab in the clinic. I mean, like, there's an herb dispensary in the clinic, but having some day during the week where I or myself and some other people could come in and we could just do herbal preparation shifts. There's all sorts of, like, I mean, my office mates have all sorts of these bottles sitting around where they're soaking things in alcohol. Some of these things take 6 months. It's like homemade creams and salves for various different things. Like, there's all sorts of stuff you can make using these, and that it isn't taught very well. So I'm hoping to find some way to do that, but we can talk about it a little bit next week. Yeah. Okay, we got one more cool acrid release exterior, which means that after that we will have a test next week or quiz next week, but it also means that we should just dive right into the next section, or at least review this as a whole. It's kind of weird doing these like 2-ish hour classes. That's not, my brain's not set up for that length of class right now. Okay, Shengma, Simisifuge rhizoma. Yeah, I don't have any tricks for remembering that one. It tends to be like round cut. No, I'm thinking of mouton. This one comes in a couple different formats. I'm not going to talk about what it looks like. Sweet, acrid, slightly cold. So sweet, we know it's going to have some sort of a tonifying or benefiting function, right? Slightly cold, just to add another slightly in for you. Again, things that people will test you on. Large intestine, lungs, spleen, stomach. One of the ways you can help remember channels is Shengma enters metal and earth. That's it. It enters all of metal and all of earth, and that's also going to tell you a lot about its functions. Let's go through that. Raises yang qi just versus heat, resolves toxicity. Yeah. Standard dosage range. Caution and contraindications. This herb is ascending, so it moves things upwards. So you shouldn't use it if the person's moved up too much. That's basically what they're saying. So yin deficiency, a sensation of qi rebelling upwards. So don't use this with nauseous patients unless it's a toxicity issue, or unless you want them to throw up. Discharges exterior conditions and vents measles. Sure. Yeah, but that's not really what we use it for. It can do that. I mean, there's some anti-toxicity functions that this herb has. So sometimes you might see this combined with other herbs. If a person's really got like some sort of toxic, like a purulent, pussy, like very bad psoriasis or eczema sort of outbreak, you see this sometimes with shingles for helping to express the rash and get it out. But it's not a go-to. It's not the first thing you think of for that. It's just helpful. Clears heat, resolves toxicity. So in this case, we're clearing heat out of the large intestine and the stomach at the top of their channels. So if you guys know where the stomach and the large intestine channels are on the body, this herb moves upwards. It goes to the top of the channels. Bleeding gums, heat in the gums, swollen tongues, swollen lips, bloody noses, potentially. Any sort of heat that's moving upwards, if it's from an exterior condition especially, and involving bleeding of any of basically this part of the body. Large intestine, stomach coming and wrapping through the jaw, right? And descending inwards down through the throat. So patients who come in with lots of tongue ulcers, which is usually a sign of toxic heat, we might be thinking of this herb. Though even there, this is going to be a relatively small part of the formula you're doing. This almost has more of an envoy function to bring it to those areas, but it'll also do some stuff once it's there. So we're going to combine this with heavy hitting herbs from the clear heat resolve toxicity category to back it up. Oftentimes, if the person only has this heat in one localized area, like the patient comes in and they had some, I don't know, they were traveling somewhere, they come back, they were in weird conditions, and they've been getting regular bloody noses and they've got sores on their tongue. We might, but otherwise they seem okay. We don't want to clear heat out of their entire system. We want to direct it to the area that needs it. If we clear heat from their entire system, we're going to have to repair their spleen and stomach afterwards. They might get depressed, they might get exhausted. We're just going to damage yang. So we want to make sure we're focusing the herbs on the area that needs it, which is right here. That's what this is for. Yeah, okay. And then the last one is actually what it's used for the most. Raises the yang and lifts what is sunken. So along with Gegun and Chai Hu, the three of these show up in formulas where the entire idea is that we want to move things upwards. So swollen ankles, varicose veins, bulging disorders like hernias, long-term diarrhea, some types of depression, some mental emotional disorders where the person just sunken down, bad posture, long-term diarrhea, I think I might have said that, incontinence, all these sorts of things. Depending on the reason is going to determine what else is in the formula, but this will just help lift, and then we treat the underlying reason. So it works as an envoy to guide the effects of other herbs upwards. So let's say we have a bunch of herbs that we really like that are going to clear heat out of the intestines, but we also want to clear some heat out of the large intestine channel. This is an herb we might include so that it's going to affect locally in the large intestine organ, but that it'll also reach up to the channel. So you can see here with Chai Hu for rectal prolapse, uterine prolapse, girdle vessel spasms. Don't really worry about that. It's a type of abdominal cramping caused by the daimai, but that's for the future. Yeah, and that's about it. So it's a useful herb. It gets used very frequently. You'll look at a formula and you'll be like, why do we have 3 herbs of Sheng Ma and 3 grams of Sheng Ma and 3 grams of Gegun in this formula? If you remember this lecture, you'll know that they're trying to move the formula upwards or lift something within the person.
Can I ask a quick question about one thing I'm seeing here is that it raises the yang and lifts what's sunken, blah blah blah, prolapse, uterine prolapse, and that kind of thing. So and rectal prolapse. that's interesting for me because I feel like that's such a physical thing. So I guess I'm curious to know, how does that lift something that's like a, like the I don't know, like the I'm trying to think of how that would work. I know a lot
Sure.
of older women who struggle with these types of issues, and I'm just trying to understand
Sure.
it.
Yeah, I mean, if your patient comes into you and they comes into your office and they say, I have a prolapsed uterus, you don't start writing them an herbal prescription. You send them to an MD and you get them checked out and you make sure that they're okay. There are plenty of people who walk around with hernias. There are plenty of people who get surgeries to correct hernias and keep getting hernias. So when I would start looking, I mean, I prescribe herbs like this fairly regularly because I like them. But if I was looking at someone who has this problem of things sinking, like if a patient has, let's say I have a 40-year-old patient who has, let's see, a feeling of things sinking in the abdomen, who has some varicose veins already, despite their relatively young age, who frequently gets diarrhea and frequently gets hemorrhoids and tends to be dry in their head. For me, that's okay. We're maybe 10 years away from them potentially having some prolapse issues. Let's say they've also had an abdominal hernia or an inguinal hernia that's been repaired. It's like red flag that this person may have problems with future hernias. This becomes preventative medicine. I don't think we can lift a hernia that's already fallen out with herbal medicine. I know people who think we can. I would not try to do that personally. I think for me, in my understanding with what I've seen, I would refer them out, get that repaired, and then give them herbs to support them going forwards. But I have seen this really turn some other things around. Varicose veins aren't going to go away, but they might stop bulging and the blood flow might get better. So they still have that vein on their leg, but it doesn't hurt anymore. They stop developing new ones, and then it kind of shrinks down. So it's just a discolored area. It's not this distended bulging vein. Okay, that's a win. Their diarrhea can go away, but what we're looking for are signs that their yang has fallen, and their yang falling is going to show up in 1,000 different places. So we're probably going to combine this with herbs that also tonify the yang, because this is a temporary lift. This is a branch treatment for lifting, but it will also help other herbs move upwards. Does that make sense? It should be like slightly confusing because some of this you just haven't learned yet, and that's the nature of learning herbs. Does that make sense in general?
Yeah, no, it does. Yeah, a lot of thoughts, but yeah, no, it does. Thank you.
Sure. There's stuff in some of these commentaries. So Lisha Jen, that's too much detail. There's detail in a lot of the commentary here about things that happen. So like we can look at Zhang Yun Su talking about without Sheng Ma, it's hard to tonify the spleen and stomach. Part of that is because if the spleen and stomach are deficient, things tend to fall downwards a little bit. So just giving this extra lift makes some of the tonification of the spleen and stomach stronger. So Sheng Ma doesn't tonify the spleen and stomach, but if you're trying to tonify the spleen and stomach, you can aid that function by lifting as well.
Because if the spleen chi is too weak, right?
Yeah.
Then like then
Spleen
you
chi
can't
or
really
spleen
tonify.
yang. Yeah. I mean, it's relieving a burden that's consistently hampering the spleen and stomach's function. But yeah,
that makes sense.
Okay.
Well,
congratulations. We finished Cool Acrid Release Exterior. Sorry, was that another question?
No, sorry. I know. Sorry. You just were celebrating that we finished, and then I'm just reading this thing about the basic questions. This is for those whom the yin essence ascends, longevity. For those whom the yang essence descends, early death. That's really intense.
Yeah. Well, that's also just the writing style.
Yeah, I mean, yeah, it is writing style, but I mean, the point is still there.
Yeah. So descending turbid yin and raising clear yang is one of the central things that we do in treating patients. That's like most patients with long-term issues, at some point, that's what you're going to be doing with them. And when you do that, you're going to want to make sure that you have herbs that help things rise. So let's say, I mean, we finished this chapter, so I can spend one more minute on this. Let's say you have a patient who has a lot of turbidity in their head, like a lot of swellings, and they're frequently, like their sinuses are always clogged up, and it's like green phlegm that comes out when they clear out their sinuses. And they get rashes on their head, but they're kind of like pustular rashes. They're really problematic for them. We can use herbs like, what are some of the ones we've covered here that will do this? Like Phuping to help descend out of the head. We've got these herbs that'll drain out of the head. But often what we're going to do in these formulas is we're going to try to raise clear into the head and descend turbid out at the same time. We say turbid yin because we're talking about physical substances, and we say clear yang because we're talking about the energetics. So it's almost like changing the oil on a car here, or it's like circulating out the old to bring in the new. And that's an important thing to do. And so very often with patients, you get to a stage where it's like, okay, let's kind of flush your system out a little bit and bring in more clarity. And all of a sudden, it's like you've done all this other stuff, and that's the thing that gets, like, their posture starts getting better. They're standing up straighter. Their eyes are getting brighter and staying brighter. So those sorts of things that make those kind of lifestyle those quality of life improvements that make a big difference. And as with all herbs, if you're prescribing correctly, excuse me, you should be able to dose down over time and then stop giving it. Yeah, okay. So we'll give you a quiz on this material next week. I would recommend that you look over keep in mind that the quizzes will often be somewhat, cumulative. So, always I would recommend putting 20% of your time into looking back at what we've already covered before this. So expect 1 or 2 questions from warm acid release exterior. I will only do ID questions on what we've just covered until we get to the midterm, where everything's open for ID and there's going to be a bunch of them. So summary of comparative functions, look over the warm acrid release exterior. It's going to help you differentiate which one is which. Yep. And then look over the this will stop fighting me someday. There we go. And then look over the cool acrid release exterior. And those 2 sections should give you a bit of a compare and contrast of all the herbs, which helps, and talk about them in the Slack. If you have a problem with an herb, post it, and hopefully some of the other students will get back and have a bit of a dialogue about it. Okay, any cool acrid release exterior questions? There will be time before the quiz next week to answer questions as well. So the standard format is going to be, we start at 6:15, 5 to 10 minutes for questions. Quiz starts, you have until 6:30 to finish the quiz. Or sorry, 15 minutes after whenever the quiz is given. Okay? So we're not going to start talking about the actual herbs from the clear heat and cool blood category. I just want to start introducing this category to you. Sorry, give me just 1 minute to find a couple things here. If anyone has questions, you're welcome to ask them. I can multitask at that level. Okay, yeah, that's what I thought. Okay, so the next section in the handout I gave you is the clear heat, cool blood section. And that is the next section in Bensky as well, but we're going to skip over that and go to clear heat, drain fire. And then we'll come back to clear heat, cool blood. Okay. So clear heat, drain fire. Pretty straightforward at the beginning here. Of course, the herbs are going to be cool to cold. In this category, I don't think there's anything that isn't at least cool. Because we're draining fire, going to be usually bitter herbs. There's quite a bit of sweet in this category as well. A lot of that is protecting against damage. We're going to see a bit of generating of fluids in here. That's often the sweetness. We're going to the liver, lung, stomach, and heart for this herb. Liver should be fairly straightforward. Hot stuff affects the liver. Lung, that should become a little more clear when we get to it. Lung and stomach are going to work as a pair here. When we're talking about those two, we're going to be talking about the qi stage of the the qi level of the 4 levels, and the yang ming stage of the Shanghang Lun. And the last one is the heart, which is a little bit counterintuitive, but the only way we can get heat out of the heart is by draining it. You can't vent heat out of the heart. There's stuff in the way. So if we want to get heat out of the heart, we drain. So that's why it's in this chapter. And the last one is we're sometimes going to drain out damp heat as well. But this is a fairly straightforward chapter in this way. We tend to dose high because we tend not to use herbs from this category unless we really need them. It's not that they're necessarily dangerous. It's that if you have fire, you get rid of fire. Fire is dangerous. So we tend to dose high. And we're not going to use it if the person doesn't have fire. That's about it. So cold, don't use it. Cold due to yang deficiency, really don't use it. And then spleen and stomach deficiency. First one of these is going to be Shigao. You learned this in Intro to Herbs, right? Okay. Did you learn Jiramu in Intro to Herbs? No. Okay. So Shigao, gypsum fibrosum, fairly straightforward herb. This is the coldest herb we have, but at the same time, it's very much not the coldest herb that we have. This was referred to at one point to me as like a cold wind blowing across Siberia. It's extremely cold, one of the coldest things out there, but it doesn't penetrate. So it's superficial in its action, but it's very cold. So it's good for putting out a fire, but if a person has deeply lodged heat, this doesn't do anything for it because it's just a breeze over it. It's sweet, but not really. It doesn't really have a tonifying function. We're mostly just going to use it for the fact that it's very cold without being penetrating. Sometimes that's what we want. We're going to use this superficially for hot stuff on the skin, and we're going to use it internally for both Taiyang and for qi level disorders. So that's Shanghang Lun, that's Wen Bing. We're going to use it for both of these. It's going to be one of our go-to herbs for both of these things. We use this semi-regularly when people have these issues. It gets used in China sometimes in massive doses just to lower fevers. It's cold enough that if you drink a lot of Shigao tea, you will just drop your body temperature. So clears heat, drains fire. It does that mostly in the stomach and clears heat from excess in the lungs. That's pretty obviously from the lungs. Clears blazing stomach fire. It's going to be this one over here. So we're using it for these, which means that anyone remember what the symptoms of these things are? There's 4 of them.
The 4 bigs.
Yes. Can anyone list them off?
Big pulse, big sweat, big fever, and big thirst, I think.
Nailed it.
Woo.
Excellent. Well done. So if a patient comes in with these 4 things, they have either I'm writing Taiyang disorder. Sorry.
I was going to say,
Yang Ming. I'm just getting carried away. Once you say yang and yin like 50 times in a day, they start to lose their meaning. So treats Yang Ming or Yang Ming, mostly channel pathology or qi level pathology. If they have these 4, we're almost certainly giving them Shigao. Gypsum fibrosum, this is a mineral. Pretty much all of the minerals are cold. So later on, you're going to learn about hematite and a bunch of other things pretty much all the minerals are cold. The last part is we use it topically, and take a look at that dosage, 15 to 60 grams. Pretty high on the dosage. Shigao is almost never used without Zhimu being present. Anemoretum rhizoma, Zhimu is also cold. Shigao acrid, Zhimu bitter. This one's also sweet, but it actually has some tonifying function. We're going to enrich the yin and moisten dryness here, generate fluids and clear heat. Actually, I can use the whiteboard for that too. Getting near the end, guys. So, the whiteboard. Okay. So, patient comes in. They've got stomach fire. If they have stomach fire, you guys can't really see that. I got to stick to black. Okay. If they have stomach fire, let's do this for 1 second. I used to have hotkeys for all of this. So a patient comes in with stomach fire. That stomach fire is really two problems. The first is stomach fire. The second is damage to yin and fluids. How much damage to yin and fluids is dependent on how long they've had stomach fire, but there's some. There's always some. And what we do is we use Shigao to take care of the stomach fire. We use Zhimu to take care of the stomach fire as well, and to take care of the damage to yin and fluids. So the two work together as a pair to address the entire problem. And we'll add in little bits of other stuff, and that's about it. In general, we use a bunch of herbs in these formulas, but these two together are really the majority. Bai Hu Tong, I don't expect you to remember formula names, or White Tiger decoction, which treats both of these things. Stomach fire, damaging yin and fluids, sounds like something we talked about earlier. This can lead to stomach yin deficiency with fire. That's diabetes. So often what we end up doing is using a modified version of these two herbs plus a couple other yin nourishers as one of our main formulas for diabetics. I gave out probably 600 bottles of this in Guatemala, and the results in patients who, massive population of patients with diabetes, none of them had insulin at all. We had pretty impressive improvements in overall health just using this formula. She's a modified version of that formula.
How did you, what did you do to get the herbs down there? Like, were you able to?
We partnered with a local church to get through customs. And then we hosted events twice a year where acupuncturists from all over would come down and treat patients. And every one of them would have to bring a checked bag. And we supplied the entire clinic with tourists bringing checked bags in as donations to the local church.
Oh, wow. That's legit.
It worked. Okay. So that's Shigao and Zhimu. The two of them go together very nicely. Let me make sure I'm not, that's the wrong one. Let me make sure I'm not forgetting anything out of, why is this coming up? Make sure I'm not forgetting anything out of Bensky here. There we go. So clearing heat. Oh, this is the next one. Yep, clears heat, drains fire. Fever without chills. Seeing the word big in there a few times. It is used topically a lot. So we'll put Shigao in topical formulas for things like eczema pretty regularly. It's not going to treat the root, but it'll help get that heat out. And then we need to bring in other things to take care of what's underneath. We're going to use it for stomach fire that affects the stomach channel. So if the person has a lot of stomach fire and it's manifesting in the gums or headache or anything like that, we may use it. You should already, I mean, yeah. Yeah, so you could, so from a private message in the chat, you could use this for psoriasis for the heat component of it, but you're not going to use it just as a powder because this is a crystal and it would be all jagged and sharp. So you got to prepare it usually into a cream. Camlo sells some great topical skin things, but you should wait a little bit before getting some. Yeah, not that worried about it. It's well covered. Shermu, she drains fire, pushes the moistens dryness, generates fluid. So this is another herb that generates fluids, so keep that in mind for it. We may use this just for fluid deficient patients, but we tend to like to use things that are less cold when we're trying to generate fluids, unless we also want to cool the patient down. There's some herbs that are like, this is a great herb for generating fluids in specific cases, and there's some herbs that are great for generating fluids at any time. And this one's good if the patient is hot. Of course, both of these herbs are going to be cautioned against in cases of spleen and stomach cold or deficiency because they're just going to wreck them in that case. This could be used for GERD, Jonathan. Yeah, I mean, it could be, but this is not so much what we're going to be using for that. I mean, I suppose you could use some Zhemu. Shugao is not going to help with GERD. I mean, it might help briefly in the same way that taking a Tums will help, but for treating it on a deeper level, Zhemu will often be something that's used without Shugao. Okay. Yeah, and the Zhemu specifically has a bunch of different ways that it's prepared. It's worth noting. So Zhemu just comes normally, but we dry fry this. We fry it in honey, fry it in vinegar. If we want to direct this to different parts of the body, one of the ways that we change how an herb is directed is by how we prepare it. Again, 99% of the time, people just get the normal versions of these things. But if you were to, let's say, start a skincare line and you're making products with these things, then it might be worth it to get 5 pounds of honey fried Zhemu if that's what you want to work with, for example. Yeah. Yeah, okay, that's enough from there.
Since you just mentioned that whole preparation, I think like 2 weeks ago, it mentioned something about like charring and how charring makes things effective for the blood. Is that?
Stops bleeding, yeah.
Stops bleeding. Is there any, like a couple sentences you can say about why that is the case?
I would recommend, to answer that question, I would recommend that you guys get the powder book, just because there are a bunch of different ways to do it. I'll put a link in here, or find someone who has a PDF, or take a look at the library. Of course, I'm not recommending that you do anything illegal. It's a useful book to have on hand. Oh Jesus, but it's out of print and it's $100 on Amazon. So see what you can do. It's also like 50 pages long. It's not a long book. I don't think we have it here. I've got a copy of this in a box in California.
Well, now you can always sell it if you're hard up for cash and make good money. $100 is expensive.
It is expensive. So, see if you can borrow it or find it in other places. Or see if you can find it cheaper. It should be like $20. But it looks like it's out of print. It's a good book. It's not a wonderful book, but it's a good book and it's a good introduction. There's a ton of different ways to prepare herbs. That's really something you're going to talk about more after formulas when you get into actually making these things. Yeah. Let's do one more herb and then we can then take some questions and call it a night, because this next one is one of my favorites. I think it's beautiful, first off, which is always a nice plus when the herb itself is attractive. A lot of the herbs don't stand out that much. And Zhemu, the gardenia fruit, Gardenia fructus, I think it's beautiful to me. Does anyone have it on hand? So this is an herb that you crush. You usually get it as these kind of large seed pods, and inside it almost looks like a desiccated pomegranate. It's like you crack it open, it's a bunch of little dark red seeds inside of it. It's got a fairly strong bitter smell, and something about like the cracking process and the opening it up, the redness, the richness of the redness is really, really pretty. I mean, it's not all the way to I'm blanking on it. The stuff in thermometers that's used to test temperatures, mercury. It's not like mercury sulfate red, which we use for some feng shui stuff, and we'll talk about in, I guess, herbs 3 as an obsolete substance. It's something we don't use anymore, but it's beautiful. This jitsa is also beautiful. So again, this is one of our rare herbs that enters the Tsungju. That's the first thing to point out. Heart, lungs, stomach, liver, Tsungju. That's a pretty broad selection of organs. And it is bitter and cold, and that's it. So this herb is going to be cold, and it's going to drain downwards. We're in the clear heat, drain, fire category, so they all drain. This is 9 times out of 10, if someone has too much heat in the heart, this is the herb we use. This is the herb that drains fire out of the heart. This herb, I have, how many times now? I don't know. It's got to be 50 times. Women with reoccurring urinary tract infections, this is the herb that stopped it permanently. Didn't come back. So a combo that you see really frequently, mild trigger warning, because we're going to talk about sexual assault really briefly. A lot of women who have had experiences of sexual assault end up developing anxiety-related issues and get chronic urinary tract infections. It's not universal at all, but it happens pretty often. And this is the herb that resolves that. It's used with other things to do so. This herb gets fire out of the heart, drains heat and eliminates irritability. Yeah, sure, that's interesting, but that's not what we care about. I guess it's a little bit what we care about. So for heat patterns with fever, irritability, restlessness, stifling sensation in the chest, insomnia, and delirious speech. So we can think of that as high fever, but we can, oh, is that, Marianne, do you have the herb there? Yeah, so that's, can everyone see Marianne holding up that herb there? So if you crack that open on the inside, it'll have a whole bunch of little red seeds. I'm not saying you should crack it open. You're welcome to if you want to. But that's, the herbs you're getting in your herbs kits tend to be slightly older versions. So if you get it relatively fresh, it's even a more brilliant red. But it's, yeah, it's an interesting one. Okay. Jarrett, thanks for the note on spotlights. That's going to be very helpful. Here's what, this is, in my opinion, this is what we use this for. Clears heat and resolves dampness for painful urinary dribbling. Well, that's not really it either. For damp heat in the lower burner, damp heat constrained liver and gallbladder, middle burner with jaundice, and damp heat in the gallbladder and Tsungju channels the face. That's kind of it. That's interesting. They're not actually highlighting its heart-related function. Interesting. So I might have to make a note in your notes to make sure you know this about it. Yeah, because it doesn't really say it here. Okay, so it's this right here. Directs damp heat downwards and out through the urine.
So do you want
Basic that.
listed as a meridian for this one?
Hmm?
Do you want us to have heart listed as a meridian for this one?
Well, it is a listed meridian.
For Jimu?
We're on Jutsa.
Oh, sorry.
Yeah, that's okay. Hey, similar names. They're going to mess us up a bunch of times this semester. That's normal. So here's the pathway. Patient comes in, heart fire. That's their diagnosis. And they're coming in, let's say, for panic attacks. We need to get this fire out. We use the heart's paired organ, the small intestine. So fire organ to fire organ. And the small intestine's paired organ as Tai Yang. urinary bladder, and we can get the heat out from the fire through the small intestine, through the urinary bladder. In fact, that's the reason that these patients get urinary tract infections in the first place. Our body naturally will try to get the fire out through the urinary bladder, and it's a way of removing the heat from the heart, which is a real problem. So in this case, if a patient has heart fire causing chronic UTIs, these UTIs are the body's natural way of getting the fire out. So very often what will happen is that when the patient treats these UTIs, they're like with Western medicine, their mental and emotional issues will get worse because it's stopping the heat from getting out of the heart. Instead, what we do is we drain this out aggressively with herbs like jutsu and mutong and a couple other things we'll learn later. And that comes out, they'll often get an especially bad UTI that lasts about 1 day and goes away. I've seen this happen, the particularly bad UTI part, about 10 times. And then it doesn't come back and their anxiety goes away. And we don't keep giving them the herbs. We give it to them for a week and it's done. Great herb, one of my favorites. Western medicine does not have much at all to offer for frequent urinary tract infections. Drink cranberry juice. Make sure everything's clean. Take antibiotics every time it happens. That's not great when you have a patient who's taken antibiotics 15 times in the last year. So wonderful herb. If you're going into women's health, learning how to treat chronic urinary tract infections in a place like New York, that can be your entire business. You could make $500,000 a year if you could really, really tackle that problem. Cools the blood, resolves toxicity for heat in the blood. I mean, this kind of clears heat from everywhere. This is a big part of this herb. I love it for this heart function, but anytime you see sanjiao, what they're saying is it goes everywhere. So cools the blood, resolves toxicity for heat in the blood, nosebleed, vomiting blood, blood in the stool, blood in the urine, and we will, of course, char it if we're trying to stop bleeding. And we use this topically as well. So if you had, in a pinch and in some blood stasis formulas and some injury formulas, jutsu will be present. I actually think it is present in this. Yeah. These Wu Yang brand medical plasters. I mean, I can't zoom in enough on this. I don't think I can. Jutsu is one of the ingredients right there. And it's in there to help reduce heat and swelling. So this is one of the herbs that we will use in herbal ice preparations. In Chinese medicine, when people get physical injuries, we never use ice. Some people will occasionally use it at the beginning. What we do instead is we use herbs that have the function of reducing swelling that ice has, but we use other herbs that make the blood move more. If you're using ice, the blood isn't going to move very much locally in the area because cold slows things down and constricts them. So instead, we want to use cold natured things that also move the blood, and jutsu is one of them. Okay, great herb. I would read through all the stuff on the commentary. I love this herb enough that I'm definitely asking questions about it, so make sure you know it well. This directing out through the urine, very powerful, worth knowing about. It's not the only herb that does this, but it's the one that does it the best for getting heat out of the heart, though you combine it with other things, of course. Okay, I think we're gonna stop there tonight. Was that enough information for one day? Maybe? Okay, well, we're gonna pause there. Quiz on cool acrid release exterior next week. Then we're gonna wrap up clear heat, drain fire, and we're gonna do clear heat, cool blood next week. I'm not trying to sprint through these things, but if we can bank a little bit of extra time that we can use later, then by the end of the semester, we're gonna have time to talk about more things like herbal preparation. I understand like giving quizzes every week can feel like a lot, but this is one of those classes where if you fall behind for a week, you're gonna start being in trouble quickly. So we're not gonna have quizzes every week, but we're gonna have them almost every week from here on out. And hopefully it'll work better next time. I might end up doing something like giving it to you to finish by midnight on the day of the classes, so it's not eating into class time either. We'll see. We're going to keep experimenting with the quizzes and see how it goes, but I think it's important to have frequent examination of this material just to keep everyone on their toes.
Dr. Collins,
Oh.
the last group, is this group right now, is it on Slack already? Have I missed it?
This set of herbs,
Correct.
I will put the document in the chat again. This is the herbs list for the entire rest of the semester.
Oh, okay. I did see that one. Sorry, I thought that, got
That's
it.
okay.
Mind.
No problem.
Thank you.
Sorry,
For
this
sure.
is also in Slack too, right? It's not only here.
All this is also in Slack.
Okay, all right, cool.
That's the master location. Everything's there. And then I'm gonna try to put it other places as well. It's also now on Moodle in the general information area, but Slack is better. Okay, so class is officially over. Thank you all, you did great today. Study up for next week, and I'll hang out for about 10 minutes for anyone who has any other questions. Thanks, everybody.
Thank you.
Did great, that was a lot of material.
Thank you.
Thank you.
Take care, everyone.
You're welcome.
Wait, you know, I did have a quick question about the quiz that we just took. I like whatever. I just got back from Maine, but when we were up there, I don't know how. I stopped at, I think Zhejiang. It was the last one that I did. So I missed all of those. Like I missed Jiangmu or whatever. Like that just wasn't on my. That wasn't in my deck of cards. So I think I missed like a few of those just because of that, which is really frustrating. Oh, maybe that hurts.
Yeah.
So yeah, so I guess how do we see our personal scorecard or whatever? Is it just gonna go straight to the email?
Well, I mean, I can show you yours right now if you want to just look at it, but I'm still figuring some of that out. So one of the nice things about how this works is the first question is what's your name, and I can just scroll through all the answers. So let's find yours. Some people entered it 3 times. Okay, that's good. Here we go. So I should be able to share my screen, and there you go. Here's your quiz. So Shishin has the low dosage range. Baija is correct. Lung, heart, kidney, good. Xiangru, I think it's.
Did I get that right though? I think I got that correct.
I think it's slightly warm, if I remember correctly, but yeah, you have at least, yeah, you're close at least. Changhuo is incorrect.
That's the one that was silly. I know it's, hold on, baby. I know it's Shisuye. I was a little wired from the trip.
It's okay. And yeah.
Yeah, that one.
Songbai. This is just scallions like you'd have in your kitchen.
Oh, and that's
one of the last ones we covered last week.
I didn't look at the last few herbs in the bottom. I think that's why I was a little bit stunned.
Yeah, looks good.
So this was not.
This one's ginger, so shengjiang.
That one is what?
Ginger, shengjiang.
Yeah, I missed that. That one wasn't in my card, my deck.
Mm-hmm.
That was right. Okay. I just was
yeah, I mean you did, so that's like somewhere around 50%.
No, oh my God.
Which is, it's Kai, don't worry, it's fine. This is the herbs program is going to kick your butt a little bit. It's going to kick everyone's butt. It's okay. Don't worry about one quiz. You now have like a 98 in the class. We're going to have a lot of quizzes because it dilutes the quizzes too. So don't worry about it. We're doing, each quiz is going to be on a category. So next week is cool acrid release exterior. You can refer to the syllabus if you want to see which herbs we covered in that, and just make sure you know those herbs. And next week is the quizzes will look like this, and then after the midterm they're going to start getting harder.
I liked that format, whatever that format was. What was that we were on?
Google Forms.
Google. Oh, I just got into it.
I tried like 10 different pieces of software, and this was the only free one that I liked, and it works great. It works great for reviewing it. The ability to actually see these pie charts of the answers, so I can know, like, okay, did I do this wrong? If half the people got this wrong, I did this wrong. But yeah, I mean, it should be good.
Oh, that makes me happy. Yeah, I was happy to see this style as opposed to just like the Moodle multiple choice. I feel like that doesn't really work for my brain, but
yeah.
All right, I'm gonna have to. Yeah. Okay. There's that on that.
Yep. Keep studying,
Right.
and don't go back and restudy the war macro as well. 20% every week, old stuff.
Yeah.
This is you're at like. Think of this as starting a marathon, and you just stumbled at the beginning, but that doesn't matter for the length of the whole thing.
True, but you always.
But it is a marathon.
Gotta shake and fill in. Okay. Guys.
All right.
All right. Well, have a good
night, Kai.
Say bye-bye. You say bye to my teacher? They all watch your classes. They're always like, "Is that your teacher?"
Oh, that's great.
Like, yeah, like, and with Jason too, I have some pictures of them like trying to pick his nose from the screen. It's really. I sent it to him, but it's really funny.
That's great.
Right, thanks a lot, Peter. I appreciate it.
You're welcome. Take care.